Hi, Sonia.
Hi. Hello.
Good evening, everybody. We're just waiting for everyone to come into the room before we get going. Welcome to everybody, speakers and audience. Right, good evening, everybody. We're going to get going, and I'd like to welcome everybody to this seminar organised by Keeper Anxious Public. We've organised this in the few days following the passage of the Health and Care Bill. The Act became law on the 28th of April. And this is our first meeting to say, what does this all mean for the NHS? And we've got to stand up and fight back. So thank you very much to the speakers who are speaking tonight, which include Sonia Adasara, Johnbosco Nwogbo from We Own It, Holly Turner was going to be able to come, but sadly, due to family illness, she's not able to join us. Margaret Greenwood, MP for West Wirral, is going to join us a little bit later because she's tied up with business in the House of Commons, so towards the end of the meeting. We've got Amelia Womack from the Green Party and John Puntis from Keeper Anxious Public, as is Sonia Adasara. I didn't say that. And I'll introduce them all again as we get to their contribution. So sorry we're missing Holly Turner tonight, who's GMB organizer and NHS nurse, but that gives a little bit of time for everybody else, and we've got plenty of announcements as well. And the purpose of tonight is to say we can fight back against what the government's doing to the NHS, and have a positive message to give out to everyone here and take it out in the fight to save the NHS. The Health and Care Act has been passed. So a big question is, what does this mean for the NHS? Some very brief comments. It nails down in legislation the government's direction of travel for the NHS that we've been fighting against for the last 15 years as Keeper NHS Public. And this struggle continues. So there's a trend very clearly to privatise the NHS, to underfund the public side of the NHS, to start to allow it to fail and to seek to be criticised by the right-wing press, to have real concerns from the general public. And the Health and Care Act now nails down in legislation that direction of travel, and it allows private interests onto NHS bodies at the whim of the chair of the local units. The NHS has been split now into 42 units starting in July, and they are all tasked with being financially independently balanced. And they are expected to make cuts and savings in order to be financially solvent. And that is a real danger, that the NHS is now no longer one integrated national system. It also allows the Secretary of State to interfere early in NHS local reconfiguration. So that could mean, for example, that hospitals such as Ealing, Charing Cross and Lewisham and other hospitals could have been told to close early by the Secretary of State, bypassing local democratic procedures. Another power of the Secretary of State that they've taken to themselves is that they can unilaterally change professional regulation, so that they could decide that certain sections of the NHS workforce are no longer needing to be regulated, and they can downskill them. And that's part of the digital NHS that they've got plans for. Some particular worrying things that the Act allows the discharge of patients from hospital without a care plan being in place. And the argument is that the care plans will be organised by community services, but we know that community services are in huge stress with vacancies and underfunding. And at the back of all this, as well as the political reduction of democratic input to the oversight of the NHS that has been part of the system, with local authorities and local people being able to comment on and have sight of the plans organised by local NHS management structures. So all of these things are very important. A lot of them are issues that have happened in the past and are being now escalated. We've got plans that We Own It and ourselves have that we'll hear more about tonight. What will the next phase of the struggle to save the NHS look like? Now, part of it is the fight for local democracy and the fight against local privatisation, but we will also hear more about the crisis facing the NHS, from ambulances in crisis to GPs and primary care, from cancer care, which is in dangerous state of long waiting lists and disarray, to mental health. And that has now seen a dangerous question emerging, especially in the right-wing press. Can the NHS cope, or should the way healthcare is delivered change in the future? Has the NHS failed? Now, for us, that's completely the wrong question. The question is, why has the government deliberately run down the NHS? And our fight is to take on that narrative and to challenge the government to win back a stronger and publicly funded NHS. Can we win? Well, this is an important issue for tonight. Keep Our NHS Public has been fighting to save the NHS for many years. We were set up in 2005 under the Labour government, when privatisation was being actually escalated and waiting lists were being addressed through private contracts, as well as promoting the NHS. Over the years, Keep Our NHS Public and our local groups have prevented the closure of key services. We've saved at least 10 hospitals. We've slowed down the march of privatisation. The NHS is facing its worst crisis ever, but NHS workers are actually fighting back against outsourcing with some significant successes. So now is the time not to be overawed, but to stand up and to fight back and to find strength in unity across the country and across different organisations. This is really a key moment in which campaigners and workers and ordinary members of the public must come together to remind ourselves what we know, that the NHS is really worth fighting for. When it's well funded and when the staff are respected, it is the best in the world, and we can win that fight. We have not lost. We have really good speakers tonight that are going to speak about this from their different perspectives and to show us some of the struggles that we can take part in that are already underway or have already succeeded. We've also got some important announcements tonight about coming actions, and Tom is going to post those at appropriate moments in the chat. But now I'd like to go to our speakers, and I will introduce them as they come in. And I'm going to invite Dr. Sonia Adasara first. Sonia is an NHS doctor. She's a fantastic and ferocious campaigner on many issues, including the NHS and women's rights and the rights of NHS staff, the rights of migrant workers to access to NHS care. She's a member of the Keep NHS Public Steering Group. And welcome and thank you, Sonia, for joining us.
Hi all. Thank you for having me. Hope you can all hear me. Yep, not on mute. So firstly, I think I just have to reflect on what we've heard today in the Sugwe report. And I was thinking about where I was and what I was doing at these times when our government and their officials were boozing in number 10. And I was working in the hospital. And I remember out of many conversations, I remember one conversation with the daughter of one of my patients. I had to tell her over the phone that her dad was dying. And I remember her tears, her crying over the phone. And I could hear her pain in her voice because she told me that she hadn't seen him in a few months because she, like everyone else, had been following the rules. I remember one of my elderly patients who was very confused. She had delirium because of COVID. And she was convinced that her daughter had died because she hadn't seen her and she couldn't understand. She couldn't, when we were trying to give her the phone to hear her daughter speaking, she thought it was all, her mind was confused and she was convinced that her daughter was dead. And I remember my uncle who died from COVID. I remember from work actually watching his funeral, not being able to be there, but watching it online. And his own son couldn't actually be at the funeral because he had COVID and he was isolating. And I mention all these things because, yes, we're here today because we care about our health service, but I think this is part of a much bigger fight that we have. And it is about the selfishness of the people in power today. It is about the fact that we have a government that is drenched in arrogance and dishonesty. This is about the fact that whilst they were getting drunk, we had workers, NHS workers, care workers, transport workers across the country who were putting their lives at risk because they thought we were all in it together. This is about the fact that we have a government that is refusing to give decent pay to NHS workers, a government that has cut funds to and denigrated our public services, a government that is now still knowingly pushing children and pensioners into poverty. At the same time, we know that they are continuing to allow the wealthiest to not pay their taxes. We are seeing the number of billionaires increase, and we know that the poorest in our country are getting sicker and are dying at a younger age as a result of this government, their priorities and their policies. So, I'm here today. Look, I'm here today as an NHS worker who is angry at the decline of care and the decline of the health of my patients. But I'm also here today as a democratic citizen who is angry at the selfishness and the negligence of people in power who have overseen this happen. And it's up to us who are on this call today to do something about it. And I know that many people within our movement are feeling quite demoralized, particularly with the passing of the Health and Social Care Act. I know many people are feeling really frustrated and helpless by that. But I think we also need to really recognise the wins and the progress that we have had within the health movement. And yet, despite the fact that we've had this Conservative government in power now for 12 years, we have Tory politicians and ministers who have publicly stated that they want to privatise our healthcare service. Still today, the majority of our NHS does remain publicly provided, and we've had some great wins over the past few years, and that is due to the fact of local groups who've been organising together, and whether that is the Ealing City of Nhs campaign, which protected the hospital, whether that's in Leicester when they saved Glenfield Hospital from being closed, whether that's in Lewisham. It's a strength of local, dedicated, organised local campaigns that are the reason why we've still got this fight on, and that we're still making wins today. Also in the trade union movement, recently we've had wins in Bart's NHS Trust, Unite the Union, with NHS campaigners and workers, fought and won to bring workers back in house at NHS Trust. So we are making wins and we are making progress. So we need to be motivated by that. Now I think I've had a permanent sore throat since I had COVID. So I think the three priorities for us going forward, number one, it's a quality of care. And I think, Tony mentioned this, and I think we have to be very clear about this. We're not simply fighting for our services to exist in the way that they are, because it's just not good enough. It's not good enough at the moment. It's not good enough that I have an elderly patient who has waited over a year for his hip operation and is increasing debilitated pain as a result of it. It's not good enough that I have a teenager who is self-harming and yet hasn't seen a mental health specialist. It's not good enough that last week I had to speak to another mother who was crying because her child was not getting the services that she needs. So we are fighting for quality, high quality services and world-class, timely healthcare for everyone. Secondly, whether you are an NHS nurse or whether you are a hospital cleaner, you deserve to be respected and you deserve to be paid well. And, again, I've spoken to one of my friends last night, and she is a healthcare assistant. Every weekend she's having to do extra shifts and she still struggles to make the ends meet. And that's not good enough. So we need to be fighting for decent pay for all NHS workers. Unison today have put up their campaign. 50,000 people have signed it because it's outrageous that in our NHS today, people are not getting paid properly. And thirdly, we need, I keep having Theresa May moments in these speeches. And thirdly, we have to end the outsourcing of our NHS services. And we have to, as Tony said, we need to end this race to the bottom of where we see health services being outsourced to the private provider, to anyone who could provide it on the cheapest. And then time and time again, we see care being compromised, and we see that their workers being disrespected and poverty pay and being denied basic rights. So last week I was speaking to a lady called Mimi. She works at Great Ormond Street Hospital. And when she was pregnant, she didn't get the maternity pay that the rest of her colleagues in that hospital got because she was on a private provider. And that's not good enough. So we need to be fighting against outsourcing. There is GMB who are launching strikes against St George's Hospital for their cleaners. So we need to be getting behind all of these strikes and all of these campaigns to bring outsourcing in-house. I'm going to stop talking now because my voice is going. But I think, just to finish, this is about the state of our NHS, about the state of care in our country. It's about the state of our public services. It's about how we value public sector workers. And it's about the type of society and about the type of country that we live in. So we need to be, I know people are feeling demoralised, but this is such an important fight. We have made such good wins in the past few years. So we need to get organised. We need to get our NHS workers unionised, and we need to campaign hard. We need to campaign together, because this is a really big fight on our hands. Thank you very much.
Thank you very much indeed, Sonia. And the real message there of anger from staff and anger from the general public, but let's channel that anger into the fight to preserve the NHS. As you say, the majority of it is still in public hands. The worry is that the encirclement of the NHS by the parasites is beginning to take more and more control of the management and the digitalization, etc. And those are some of the things that we can still fight up and down the country in our local groups as well as nationally. So that's a good introduction, I think, to the next speaker, whom I'd like to welcome, Johnbosco, who is the lead for We Own It on NHS campaigning. And he's also part for We Own It, part of our SOS NHS coalition, which we got 50 organisations signed up for to work together over the winter. That's the most successful NHS coalition, I think, that we've ever been involved with. So Johnbosco, who's been greatly enthusiastic and a great impetus for new initiatives, is part of We Own It that fights against privatisation of a whole range of public services that should be in public hands, from water and energy to education and health. And so very strong welcome to Johnbosco now.
Thank you so much, Tony. I think you may have just stolen the part of my remarks that I normally use for getting rid of my nervousness, which is saying a little bit about what WeOwnIt does and is. But I guess it helps that people now know who we are and what we do. So I'm going to just start by kind of saying a little bit about the work that we've been doing around what was the Health and Care Bill and is now the Health and Care Act. We started campaigning on the bill as soon as it was essentially officially put into Parliament. And I would say that our approach from the start was what I would like to describe as an inside-outside strategy. So we of course, were 100% with people who said, this is horrible, this is evil, we have to oppose it, we have to stop it. And our messaging was basically, we have to oppose it, we have to stop it. But we were also very, I don't like to use the word realistic, because I don't want to suggest that those who didn't want to go that way were not realistic. But we also knew that the government had the votes to make this bill happen, if they wanted really to make it happen. And we thought, well, that there is room potentially to push them on certain elements of the bill. And as Tony pointed out at the beginning, although we care about a great deal of pretty much everything that's happening with the NHS, we try and think about issues that are much more explicitly having to do with outsourcing and privatization. So we've put a great deal of energy into campaigning for an amendment to ban private companies on NHS decision-making bodies. And this included the ICS boards that Tony mentioned earlier, but also provider collaboratives, which many people may not know about, but ICS's integrated care systems, which is what the NHS will now be divided into, are required to be a part of provider collaboratives, which will include not just these ICSs, but providers like trusts and foundation trusts, but also private companies. And a good number of decisions about what services will look like and who is going to provide them look like they will be made in the context of provider collaboratives. And of course, this also includes what they're calling the place-based partnerships, which is a body kind of mapping onto a local council that will include local authorities, but also providers. We pushed on that amendment, and we also pushed on an amendment that essentially said that the NHS should be made a default provider of all NHS services. In essence, if a service is available to be commissioned, NHS administrators should think of the NHS automatically as the entity that's going to provide that service, without having to kind of put out an elaborate process of commissioning that private companies may have access to. Obviously, we did not have as much success in that endeavor as we hoped we would, but we did have some wins. We organized for 10,000 people to email the Public Bills Committee when the bill was in the committee stage in the Commons, and I think it's fair to say that we succeeded in forcing the government to put forward an amendment that was geared to make it somewhat more difficult for private companies to be appointed onto the boards of those of the ICS boards. Initially, just wasn't anything there, but the amendment they put into the bill, which is now part of the law, is that ICS chairs will have the authority to veto the appointment of anybody who, according to them, who they think whose interest undermines the independence of the NHS. Obviously, that still leaves what I think is a private company shaped hole in ICSs that they can wiggle through anytime they want. All they have to do is argue that this person's interest don't undermine the quote unquote independence of the NHS, and it's not very clear what that means. But what that shows is that there is scope for some success, even with what appears to be a government that clearly has an agenda to hollow out the NHS, and has a stranglehold on the legislative process. Yes, it's possible to get something even from that kind of bleak situation. We continue to pursue trying to get changes to the bill into the House of Lords, but we decided to kind of put an end to that endeavor when we found that despite agreeing to push those amendments in the House of Lords, include some Labour peers who were supposed to help us do it there, took concessions from the government behind the scenes without actually getting anything in writing. And as soon as we saw that, we just thought, well, this fight is finished in Parliament. So we pivoted straight away to a campaign whose goal really is to go directly to the ICS chairs, who we already knew will have a good deal of flexibility, but this amendment that the government had put in the bill gave them even more power in terms of who ends up on the ICS boards, but also decisions that are made about who's going to provide services. So we launched our Rebuild NHS campaign, and it's very gratifying to see that KOMP is also running our Rebuild the NHS campaign. I think it says something about the wavelength that we are operating on. We are essentially all agreed that the fight really is to rebuild the NHS into what it has been in the past and what people expect it to be. We created a tool what we call the Find My NHS tool. We called it the Find My NHS tool, despite it not being a very good name, because we wanted it to have a very non-political name, so that when Joe Public sees it, they don't think that somebody is trying to ensnare them with left-wing politics. And it's been, I would say, a very good success. Over 14,000 people have used that tool now to email their ICS chair. But it doesn't just allow you to email your ICS chair, it allows you to find out about what NHS body you're going to be under now and who's the chair of the body and what they have committed to doing. And thus far, we've gotten 6 of those ICS chairs to commit that private companies will not be allowed to sit on their boards. And we have 6 others who I like to think of their pledges as half pledges, where they've essentially suggested that they don't see it as a possibility that private companies will sit on the boards, but they have not told us that they will not sit on the boards. So in essence, we are going to have to keep pushing on those 6 and on the others who have not yet given the pledge. But I think the pressure is working, because our calculation from the beginning was that Parliament is important because it's important to make the case nationally and to help move the direction of the discussion. But the real fight is going to be locally, because the people at a local level, whether it's the councils and whether it was the CCGs before the ICSs, there was so much more, or they're so much more susceptible to public pressure. They're not as obstinate as Tory MPs or a Tory government who doesn't just have arguments as to what's going to be better for patients. They also have an ideological obsession with private companies doing those things, right? So far, so good. And we are working toward the 11th of June, the Saturday, 11th of June, when alongside Keep Our NHS Public and Unite Community, we're going to be having a day of action across the country to continue to mount pressure on those 6, well, pretty much all of the ICS chairs, but in cases where they've already taken the pledge against private companies on their boards, we're going to ask them for more. And in places where they haven't, we will push them and make them begin the journey with us of kind of going in the other direction toward a service that works for people and not profit. And I did want to say, and I think Sonia mentioned this in her remarks, that local KOMP groups are really where the action is. They have been campaigning against ICSs from the beginning, even before the bill was put forward. And they continue to do so. They do a great deal of hard, dirty, detailed work that nobody sees. I mean, people in their local area see it, but people nationally don't see it. And they win things. They force these local bureaucrats to go in the other direction than the one they wanted to go in. So I wanted to kind of make a point of really pointing out to people, if you're not a part of your local KOMP group, get involved. It's really important work. You don't have to do every part of the work that they do, but it's really important to get involved with whatever you can do. If it's delivering leaflets, if it's putting up a poster in your window, whatever it is, get involved and do that work. It's really important. I just wanted to close by making what I think is a general point about why we decided to call our campaign Rebuild the NHS Campaign. My general theory has been for some time now that the NHS needs funding because it's been underfunded, and that's one of the ways that they're undermining it. But I think that what it needs more than funding is a structural change of direction, right? It seems clear to me that the goal of this government is to hollow out parts of the NHS. I remember seeing a guidance that was issued by NHS England, I think it was last year, to NHS trusts across the country, recommending that they divest themselves essentially of their radiology and imaging departments, and kind of recommending as one of the options, giving it over to private companies. Right, so there is a systematic effort to hollow out parts of the NHS, which will have, and we are already seeing the impact of that, two effects. One of it is creating a waiting list like the one we have right now, and forcing hundreds of thousands of people who do not have the money to, and do not want to in the first place, to use private healthcare. And last year, private healthcare brought in £1.1 billion in revenue and over £200 million in profit. That was the goal from the beginning. And the second effect it's going to have is it's going to force NHS bureaucrats at a local level to think that they have to commission private companies to deliver these services because they don't actually have the capacity within the NHS to deliver them. So I think it's important to impress on those local NHS leaders that among the options that they think is available to them when there is a contract for them to consider who to give it to, one of the options should be consider creating the capacity within your local NHS and delivering that service in-house. I think of it a lot like what has happened with local council services. I think I would say a decade or two before Jeremy Corbyn became leader of the Labour Party, especially, but maybe some years before that as well, it seemed natural that services were going to be delivered by private companies at a local level, whether it was waste or food delivery to schools and all of that. But as soon as the budget started tightening up, we saw even Tory councils, like I live in Oxford, and we were considering a free school meals campaign some time ago, and I called up the Oxfordshire school meals people, and they told me that they ran the service, a private company ran the service previously, and the Tory council in Oxfordshire decided to bring that service in-house, right? If we think about it in those terms and kind of impress it upon them in those terms of building up capacity in the NHS to save money, to make sure that the quality is good, as Sonia was talking about, I think we will likely have a great deal of success along those lines. And that's what our Rebuild the NHS campaign is aiming to do. And I think that that's the direction that a lot of our work will take. Obviously, we will take opportunities to try and get wins wherever we can find them. But that is more or less the direction that I think a lot of NHS campaigning needs to take. And I think finally, there's a patriotic angle to this. The NHS is, in some ways, the thing that Britain should be the most proud of. And it is the thing that we should be citing when the right wing is citing the military. We should be citing our NHS. And people will not take kindly to somebody, just as they will not take kindly to somebody undermining the military. We should make it the case that they should not take kindly to somebody undermining the NHS. We should invest money into it and rebuild capacity in it so it can do everything we wanted to do for people and not profit. I'm going to stop there because I know I've spoken too long, but thank you so much, Tony and KOMP for inviting us to this.
Thank you very much, John Bosco, and well done with the success of your initiative so far, which we will be joining in with alongside you. I'm going to move on straight away. We've got 3 more speakers, and I know Amelia has joined us. So I'm going to welcome Amelia Womack, who's the Deputy Leader of the Green Party and is also for the Green Party part of People's Assembly. I would very much welcome the Green Party taking part in this And although Margaret Greenwood is going to be speaking later, both Caroline Lucas for the Green Party and Margaret Greenwood were the first two private members supporting the NHS reinstatement bill in 2014, 15 and 16. But welcome, Amelia, and thank you for joining us.
Thank you so much. And thank you to all of those powerful contributions. Thank you to Keep Our NHS Public and to everyone who's here tonight. By being here, we're giving a voice to this crucial issue. It's about standing together as a community. And we show that when we stand in solidarity, shoulder to shoulder with patients and staff, that we are stronger. And I think, I'm really proud of all of us here standing up in opposition to this shameless harm being imposed on the NHS in England. As I said, as Greens, like you, we firmly believe that this act does the opposite of what it's meant to do and does direct harm for this beloved institution. It's another example of smoke and mirrors, and it's something we've come to expect in the last 12 years of this Conservative government. It's something we've come to expect from a Prime Minister who lacks any integrity, one that is happy to lie to Parliament and to gaslight this country. This act should protect the most vulnerable so that nobody is abandoned in their hour of need. And to me, that's what the NHS is. It's a lifeline in people's hour of need. And that's why it breaks heart. Like, it's just, people who always expected the NHS to be there when they pick up the phone and expect an ambulance to come. The reality is that the whole institution has been forced to not be able to deliver in what it's meant to be there to do. Because we should be empowering workers who stand on the front line of this challenge and who already struggle every day to meet stressful demands on longer hours, while our NHS is given just a shoestring of resources. It should have people and communities at the heart of its service. And instead, it makes lives dependent on affordability, meaning that some could be refused emergency care if they can't afford it. It opens the door to private companies, putting lives in the hands of profit. And let's be really clear, health should not be profit should not be prioritized over health. It's just a fundamental. Do you remember when we used to go out on demonstrations to fight for something better, to go on demonstrations to fight for a better NHS? And 12 years of this Conservative government, and I feel like we're all exhausted by hoping that they don't do more damage, don't make things that little bit worse. And that's not even those people, 10 times that exhaustion for those who are working in it, whose lives, who are accessing it every single day. I just feel like today of all days, our weariness is gathering of how much we can tolerate. It breaks our NHS into separate local financial systems, putting pressure on integrated care boards, and it cuts budgets and staff boards. And it does all of this in the deepening staffing crisis, exacerbated like never before by COVID-19 and Brexit. It's the pressure that this act puts on resources means that integrated care boards, which is also ICS boards, are likely to compromise for cheaper staff and more digital services. Patients will lose on quality of care and struggle to access services. There'll be fewer face-to-face appointments. It will be harder to see their same health worker, and access to care will often be dependent on digital literacy. Services will be cut or rationed, non-urgent referrals will be delayed or refused, and patients will be discharged from hospitals faster. In other words, the burden of care will progressively be displaced from the system and transferred onto patients and their families. If COVID-19 has taught us anything, it's that we must do better for key workers who have seen us through this pandemic. And frankly, not just because they've seen us through this pandemic, but because they've seen us through every crisis, the health crisis that our friends and families have experienced year after year after year. What this government needs to understand is that all of these failings put actual lives at risk. In areas like Suffolk, the Care of Quality Commission found that more than 100 patients died in the region unexpectedly in a 2-year period at the hand of England's worst performing mental health trust, Norfolk and Southwark NHS Foundation. And these are conservative estimates. Mental health campaigners believe there could have been as many as 1,000 avoidable mental illness related deaths in the trust over the years. And why? Because of underfunding, of staff shortages, and of unstable management. The very same thing this act threatens to exacerbate. As Greens, we believe that as a society, we can do so much better. The NHS is has an amazing history, and it has the potential to have an amazing future too. All we need to be done is to invest in it and actually listen to those who stand at its heart. This government is never going to live up to this. They are proving that beyond measure with this act. And instead of being an opportunity to genuinely integrate health and social care and to address the huge health inequalities which have been exposed by COVID, it's actually dismantling some of the fundamental philosophies that makes the NHS ours. Together, we must build on the founding principles of the NHS health service, which is universal, publicly provided, free, and in the hands of the public. We need a bill that makes local and national governments responsible for eliminating health inequalities, which provides the resources to do so. We need a bill which replaces private sector involvement in the NHS with community leadership, because healthcare is a basic right and not a commodity to be bought or sold. We need a bill that puts democracy and accountability in the driving seat. I often say that one of the most frustrating phrases that I have ever heard is keep calm and carry on. You'll remember it from a few years back. It was everywhere. It was on mugs, it was on t-shirts. I'm sure you could have even got a duvet set with it on. I don't want us to keep calm and carry on. I want us to get angry and get organized. And boy, am I angry. Like, it's just incredible what's been happening in our parliament, in Downing Street, and in our communities because of the failure of government and the failure of politics. And I'm really proud to be with you tonight in collective anger and to ensure that we do get organised. You would have seen in the chat ways to do that, whether that's signing petitions, whether that's donating, whether that was hearing from Johnbosco about how to organise in our community. Get angry, get organised. Let's stand against this together. Let's make a stand and ensure that we build the NHS that we so vitally need right now and put a stop to how this Conservative government is continuing to dismantle the things that we love.
Thank you very much, Amelia. That's lots of passion and support for the NHS, and we do welcome the support of the Green Party in Parliament. Caroline Lucas has been pretty fearless and fearsome, and that's very, very much welcomed. And I'd now like to welcome Margaret Greenwood, who is probably breathless rushing from her work in the House of Commons, but thank you very much, Margaret. I hope you're okay to come in next now. Margaret's Labour MP for Wirral West, and sponsor of the private member bill, as I mentioned earlier on, the NHS reinstatement bill, which we put together. That was Alison Pollock and Peter Roderick and Lord David Owen, 2014, hoping for it to be part of the Labour manifesto in 2015, but that election went wrong. But Caroline Lucas then was the first private member, and in the new session of Parliament, Margaret Greenwood took up that baton to fight for the NHS reinstatement bill. And unfortunately now, with such a huge majority in Parliament, that is not an immediate prospect. But the very principles embodied in the NHS reinstatement bill were absolutely pertinent and are the principles that will guide our fight against what's going on now, heightened as it is by the Health and Care Act. Margaret has been an excellent critic of the government, one of the very few voices in Parliament that have shouted out that we don't want this health and care bill. It's unreformable, and we lost that fight, but we haven't lost the war. So welcome, Margaret, and thank you very much for joining us tonight. And thank you recently for becoming a patron of Keep Our NHS Public.
Great, thank you so much, Tony. And apologies, I'm sorry I wasn't here earlier. I would have loved to have heard the earlier speakers. And yeah, I'm thrilled to be invited to be a patron of Keep Our NHS Public, and very, very pleased that you've extended that to me. So I want to begin by just paying tribute to absolutely everybody who campaigned against the Health and Care Act, as it now is 2020, when it was Health and Care Bill. And I know there was a phenomenal amount of campaigning going on all around the country, and it was in very difficult circumstances because, of course, we had COVID, which made things especially difficult. It is a truly devastating piece of legislation, and it was, you know, you keep saying with this government, could it get any more shocking? But it was certainly shocking that they decided to press ahead with it at the time when NHS staff were absolutely exhausted. Patients and people across the country were struggling with the pandemic. So now we find ourselves in a position of really uncharted waters because, of course, it's new legislation and it's in place. And what we're likely to see is health service becoming increasingly fragmented, especially from after the 1st of July of this year, when statutory integrated care boards and statutory integrated care partnerships are established. So it's vitally important that we're clear about what it is that we're fighting for, namely that we want a publicly owned, publicly run, comprehensive national health service, and nothing else will do, actually. So that's what we're fighting for. And it's also really important that we do all we can to scrutinise the fallout from the legislation and what's happening at ICB level and place sub-ICB level. And of course, Keep Our NHS Public has already made a great start with some of the key issues to campaign on, and there's plenty on the website about that. I'm going to touch on some of that a bit later. Now, because of the fragmentation that this act brings in, it is going to be difficult. It's going to present lots of challenges because it's going to be a new structure. People are going to be learning new structures, new personnel in lots of places. But one of the things that's going to be particularly difficult to do is to identify where rationing is happening, and understanding. This is less difficult to understand in a sense, but it's very important that we articulate it, is, you know, which parts of the country people might not be getting access to the treatment that people are getting elsewhere. And I think this has to be a key aim of ours, to work out how to understand those things, because of course people not receiving care is much harder to identify than people receiving care, because there isn't a log of who's been turned down. I think it's important that people highlight to their members of parliament and to local councillors when they feel that they might be being denied treatment. I think it's important for people who work in the health service, who have insights into changes in the way that treatments are allocated, to raise those with their MPs and their councillors. And it's also important to put pressure on MPs to raise issues like this with the government and in Parliament. It's important as well, I think, that people continue to be involved in patient participation groups, and that local health watch groups use any means that they can to try and influence their local systems. But it's a sad day, isn't it, when we're talking about local systems rather than a national health service. So just to reflect a little bit on the bill, you know, we always knew it was going to be difficult to effect major changes to the legislation, given the size of the government's majority and the government's intent in this regard. And it's also been very difficult to gain coverage in the press. And so going forward, one of the things I would say is that we have to make sure that we use all means possible to get in the press and on broadcast media. So things like letters pages, radio phone-ins and all the rest of it. And the two areas that I would be inclined to focus on, because there's lots we could focus on in that regard, but one would be rationing where we see it, and the other is the amount that private companies are siphoning off in profits. Because I think that it's very difficult talking about, I mean, you know, as campaigners, we talk about structures, and it's important we can do that, so we can put down amendments that you know, make sense and so forth. But in terms of the general public, identifying rationing, that's something people understand. They can relate to it. They know people who are experiencing it. And identifying what profits the companies who are taking on contracts are receiving, I think is very important. Twofold reasons, really. One is to demonstrate that it's more expensive to run a health service if you get the private sector to do it, unless, of course, they run down terms and conditions of staff, which, of course, is something we have to oppose as well. But also, you know, you can say, you know, that money would have bought X more operations, Y more interventions of whatever nature. So I think it's really important that we really hammer the government with that material, and that we use it through any means of press, media, including social media, of course. So, I mean, I'm sure everybody in this call knows, you know, just the disservice this act means for patients and NHS staff. It opens the NHS up to widespread privatisation. Now, in the course of the passage of the bill, the government were forced to come forward with amendments to keep people with involvement in the private healthcare sector off ICBs and ICB subcommittees. However, I think they're weak amendments. And I think that the very fact the government had to address this is testament to all the work done by campaigners. So very important we scrutinise closely who's appointed to ICBs and the vast array of subcommittees and how they are appointed to them. The Act also, I believe, provides the scope for the undermining of the scope of Agenda for Change, which is the pay and terms and conditions of about 1 million people who work in the health service. So the bill has, the Act provides for the national tariff to be revoked and that to be replaced with an NHS payment scheme. And I think that given NHS England will be required to consult with what they call each relevant provider, including private providers, before publishing the NHS payment scheme, that this will be a mechanism by which the government will give private health companies the opportunity to undercut the NHS as part of that process. I put down amendments to try and stop this happening, but of course they weren't selected and they didn't go through. But if this happens, I think that one of the inevitable outcomes will be an erosion of the scope of Agenda for Change, as healthcare that should be provided by the NHS increasingly gets delivered by the private sector. And we may well find situations where NHS staff find themselves forced out of jobs that they're currently on, where they receive Agenda for Change rates of pay and pensions and so forth, with only private sector jobs, potentially lesser paying conditions available for them to apply for. Am I okay for time, Tony? I can't hear you, sorry.
1 or 2 more minutes, is that okay?
1 or 2 more minutes, right then. So very quickly, so the government had indicated that they expected, there was an expectation that trade unions would be consulted. So we need to make sure that we hold the government to account on that. And the trade unions, of course, we need to make sure that they engage in this process fully and understand the implications of changing to tariffs. Because once the tariffs have been set, it'll be too late to do anything about that. Around discharge from hospital under the Discharge to Assess scheme, I think that we need to be demanding detailed analysis of patient outcomes. For example, we can ask ICBs how many patients discharged in this way are readmitted to hospital within 30 days of discharge, and we can ask for them to publish this information on a regular basis. The bill does nothing to tackle the chronic staffing shortages or to tackle the increasing long waiting lists. And the government rejected helpful amendments on this. So again, it's important people raise these with press and with MPs and, with the press and with MPs and councillors. There is also the issue of the allowing for new procurement regulations. This is going to be really significant. And I think it's very important when the regulations come out again that we scrutinise those in a lot of detail and articulate what they will mean. And there is, the Act is unclear about people's right to receive emergency care. So the Act itself doesn't mention emergency care. Now the government said in the Lords that, and this is a quote, the legislation makes it clear that each ICB has to arrange for urgent care services to be available for all people physically present in the area, not just for the people who are its core responsibility by virtue of their GP registration. I put in a written question about this last September. The government came back and said that once the statutory ICBs are established, regulations will be brought in to do this. But my feeling is we don't have those regulations at the moment. And so I think that it does make sense to ask ICBs to include this in their constitutions, which they're in the process of drawing up now. I just want to mention maybe just one other thing. So the NHS Constitution, handbook to the NHS Constitution, I put in a written parliamentary question this month to ask the government whether they plan to amend the NHS Constitution and the handbook of the NHS Constitution to reflect the changes in policy and legislation as a result of the Health and Care Act. And the answer I got from Ed Argar, the minister, was, and he said, the next scheduled updates are due for publication in 2025 to reflect changes in policy and legislation as a result of the Health and Care Act 2022. So that sounds like, yes, there are going to be amendments. So I think that what we can do is call on government to protect the NHS Constitution, and we can lobby MPs to pledge to protect it. I think in order to do this, we need to identify which key aspects of this we particularly want to highlight in such a pledge, both by virtue of looking at the changes in the bill and what we might anticipate they might want to change, and using that as a means to identify, but also the broad principles statements of what we want our NHS to do and to be for all of us. So just to say, you know, we're all here because we want to fight for a publicly run, publicly owned, free and comprehensive national health service available for everyone who needs it, and we must keep up the fight. Thank you.
Well, thank you very much, Margaret. I thought that was a really helpful way of dissecting some of the real dangers that are there and some of the ways that we can focus on fighting back. And it contributes hugely to a plan for the next couple of years. It might be very useful. I don't know if you've got notes from what you've just said, but whether we could share those. But thank you very much indeed. And thank you for all the work that you've done, especially in the last few months when you've been, unfortunately, a little bit of a lone voice. I'm going to move on now to John Puntis, who is co-chair of Key Nhs Public, shared with myself. John is retired NHS paediatrician. He's part of Leeds Key Nhs Public. They're doing fantastic work there. One of their great contributions is amazingly innovative banners that they share around the country. Anyway, without more ado, thank you very much, John, for being our final speaker.
Thanks very much, Tony, and thanks to all the previous speakers. After the passage of the Health and Care Bill, the reality is that we have our work cut out to campaign for the reinstatement of the NHS based on its founding principles, including universality. And the public really need to understand just what is at stake. This is one of the reasons why campaigning over migrant charging, for example, is so important, because under the current charging system, free access to care is actually not available to about 1 million people who do not have official immigration status. We need to focus in our campaigning very much on issues that people are currently concerned about, things which in a sense are easy to see, such as long waiting lists, but also the crisis in general practice, people being put at risk because ambulances don't arrive promptly. And we need to explain that all these are direct consequences of government policy choices to shrink the social wage and redistribute wealth from poor to rich. John Lister's coming up with some very useful information on financial positions of integrated care systems in the lowdown, and I'd urge people to look at that. Nearly all are projecting substantial deficits in their first year, adding up probably to around £4 billion, with every health system now facing real-term spending cuts. This means cuts in services. It can't mean anything else. And West Yorkshire Partnership Board, which will soon become the ICS, is already talking openly about the importance of managing public expectations. We must, as Margaret was saying, we must be looking very carefully now at the implications of the Act in practice. We should publicise any cuts, and we should continue vigorously to oppose privatisation, arguing that it is inefficient and that it undermines NHS services rather than providing added value. We should be making a noise about dentistry. This is something that we haven't done, but there are campaigners there very much pushing the case for a return of NHS dentistry. Incredibly, in a report that came out yesterday, only 1/3 of adults and less than half children in England now have access to an NHS dentist. At the end of 2020, there were 8 million people waiting to find an NHS dentist. England now has the lowest number of NHS dentists for a decade, with almost 1,000 leaving the service in the year ending March 2021. And the reasons for this are very familiar. Problems with erosion of pay, low morale, difficulty recruiting staff. And this is leading to dental deserts, such as Lincolnshire and Staffordshire, where there's serious risk to the dental health of millions of people. Ambulances are also in crisis. We know the ambulance services are in deep trouble. One trust has just warned it may completely collapse this summer. A report last year concluded that up to 160,000 patients may have come to harm because they could not be transferred into A&E departments. It was also estimated that there are around 4,500 deaths in England as a result of overcrowding in emergency departments and stays of over 12 hours before people could be transferred to wards. The monthly average number of patients with delayed ambulance handover in 2021 almost doubled to 15,500. And the president of the Royal College of Emergency Medicine has said that the NHS was breaking its basic agreement with the public to treat the sickest in a timely way, commenting that the true barrier to tackling this crisis is political unwillingness. The current situation is breaking the workforce and breaking our hearts, is what she said. We've heard a little bit about staff, and we really do need, as campaigners, to stand shoulder to shoulder with hard-pressed staff who deserve pay justice after years of public sector freezes. The workforce crisis is not being seriously addressed. In fact, none of these issues that I'm talking about and will continue to talk about are being addressed by the new legislation. And the main barrier to delivery of quality services is not having staff. More than 27,000 nurses and midwives quit the NHS last year, many of them citing job pressures as the reason. And heartbreaking stories have emerged from some units, such as the emergency department at the Royal Preston Hospital, where staff were pleading to the trust executive for help because they regularly were dealing with more than 50 patients in A&E waiting for a bed, often more than 60 hours. Senior staff were sometimes crying with frustration and anger. Staff at the Royal Derby Hospital were also driven to tears from stress and exhaustion, with additional pressure from an unsupportive trust board, including instructions that if they were going to cry, make sure they did that in private and well away from the view of patients and visitors. What about GPs? How can we support GPs at the same time as acknowledging patients' concern about difficulties in access? GPs are overworked. They've become the target of vilification by the populist press and the government. The number of GPs has fallen every year, down almost 1,500 in England since government pledged an increase in 2015. Many routinely work under extreme pressure and well beyond their contracted hours, and they're frequently subject to abuse. Increasing numbers are looking to early retirement as a way out. The suicide rate for doctors has been estimated at between 2 to 5 times that of the general population, and GPs are at the greatest risk of suicide compared with other specialties. The UK has the lowest number of doctors and nurses per 1,000 people among the Organisation for Economic Cooperation and Development countries and the EU. Annual GP and practice nurse consultations have gone up by 16% over the last year. UK GPs see far more patients daily than their counterparts in 10 other high-income countries, and only 13% of GPs, when asked, thought their practices were actually safe for parents or for patients all the time. The government has no answer here, except to promise more GPs and then admit their targets will not be met. We already work closely with NHS Workers Say No and health unions, and we must do more to support workers demanding an end to outsourcing and inferior terms and conditions, while also highlighting the dangers posed by the Health and Social Care Act that Margaret has already covered, the likelihood that financially challenged integrated care systems will be motivated to undermine national pay terms and conditions, downgrade and deregulate staff. We're working through health campaigns together and the SOS NHS coalition to strengthen our links and joint working with the trade unions. Moving on briefly to data, we know people are very concerned about their data being misused and exploited for private profit. This was shown last year by over 1 million people opting out of the GP data harvesting. And a recent paper in the British Medical Journal shows that data breaches are already very common. Our data working group is doing great work here, alerting people to the growing risk of loss of control over personal data and its potential for commercial exploitation. And this is something which campaigners really need to get stuck into. What about a national care support and independent living service? This is part of our campaigning too. The government has not fixed social care. It's doing nothing to stem the impoverishment and increasing exclusion faced by disabled people of all ages. Cash-strapped councils are clawing back every penny they can get from people's disability benefits. Government is doing nothing to ensure that care and support workers are paid a wage that reflects the value of their work and stop the steady drain of staff into other jobs in call centres and retail. We urgently need to unite in a massive alliance of older people, disabled people's organisations, trade unions, health and other campaigns. Together, we must build active resistance to current life-threatening attacks to take away what little support people have already and to promote radical social change. This needs to go well beyond calling for services just to be publicly provided and free at the point of use. Finally, let me finish by leaving you with this quote from Donna Ockenden from her maternity services report. She said, "The demand for better funding will ensure safer outcomes for more women and families, reducing the risk of unnecessary loss of life, injury, and resultant heartbreak. Only with a robustly funded, well-staffed and trained workforce will we be able to ensure delivery of safe and compassionate maternity care locally and across England." Well, that's true for maternity services, but that's true right across the whole of the NHS. And the lessons from that inquiry are surely transferable throughout the whole service. The passage of the Health and Care Bill, as Tony said, is a battle we lost, but the fight was worth it and we have learned lessons, and it does not mean that we've lost the war. To those who want to hold a wake for the NHS, I have to say that interment is premature. There is still potential, I believe, for return to full health, and there is plenty left to fight for, as Sonia pointed out right at the beginning. We have a fantastic team in COMP. We've got brilliant campaigning members and supporters, so let's get on with it. Thank you very much.
Thank you very much, John, and thank you again to all the speakers, because today the meeting was What Next for the NHS, Stand Up and Fight Back, and we've had a lot of ammunition to know what to do and how to do it. So Sonia's basically told us to channel that anger and put it into action, and she reminded us of significant wins that campaigners have achieved over the years. And Johnbosco showed us how active they've been in the We Own It campaign to get pledges from integrated care boards on private involvement. And that is an achievement that, of course, will have to be followed up for the next years and years. And thank you, Amelia, for joining us and talking about the importance of fighting for health and not for profit. Margaret, I think you've given us a real dissection of the dangers of the Act and the ways to fight it. And John, you've reminded us of things that aren't always in the public's mind unless you've got boring, terrible toothache, the increased demise of dentistry. There was a terrible program on last night with somebody talking about pulling her own tooth out. And the dangers of data and the workforce crisis. And overriding all this, the message that the NHS has not been lost. There is plenty there that's still publicly provided. It's our job to put it back together again and to fight for political change and change for the NHS and for social care. So thank you all very much for your contributions. Could I just we've had a really good attendance, and I know we've run over a few minutes now, but you've all been very, very good at sticking with us. Tom's put a lot of information in the chat, and if you don't know already by now, if you can save the chat by clicking on the 3 dots down in the bottom right-hand corner. But there's lots of links to information and to events coming up, and they will also be on the Keep Our NHS public website. But in the events coming up in the next few weeks, we own its day of action on the 11th of June. The TUCs demand better on the cost of living demonstration. That's on June the 18th. And there'll be a national day of action on the 2nd of July for the NHS's 74th anniversary, including a march in Yorkshire on that day. So please do look at the chat and save all those links, or look at our website if you've missed it. And please do also think of actually joining our campaign, becoming an active member in one of our 70 local groups, or setting up a new group. And please also, if you can do nothing else, think of donating to the cause, because we desperately need more money in order to carry on with our fantastic team, of which 2 people are here tonight, Tom and Lewis, and thank you very much for all the work. So one final thank you to all the speakers, and thank you to the great audience who've kept with us throughout. Good night. See you soon.